Good morning, guys. I hope we're all sparkly. As you can probably hear, it's raining. Dexter doesn't care. Dexter wants to go out for his run. So as you can probably tell, these videos, they're not scripted. I often have distractions. Irrespective of Dexter desperate to go for his run, I have night smooth thinking. I'm all over the place. So, what are we going to talk about? We're going to talk about why we microdose testosterone replacement therapy. And as I've said before, it is the most effective way of achieving stable male androgen levels. However, we also need to practice evidence-based medicine because we must be safe and we must be effective. Now, we know that NHS protocols are safe, but they're not particularly effective because the agenda is disease prevention, not health optimization. So the NHS doesn't really fully appreciate how necessary a healthy testosterone is for optimal well-being. Yeah, sure, they don't want you to get sarcopenia, osteopenia. They don't want you to feel rubbish. But they don't truly appreciate the importance of having levels that mimic physiology, and that's daily microdosing. So there was an article in the Telegraph the other day written by a private GP who also works for the NHS. He said, if you do anything other than prescribe Testogel or 12-weekly libido injections, and you suggest it's better, you are lying. No, you're lying, or you don't understand basic pharmacokinetics or physiology, and you're not acting in the best interests of your patients, because a lot of them come to my clinic. So, what's going on? Well, he has an agenda. My agenda is to just simply act in the best interests of my patient. And as I've said before, if there was a better way of doing it, and we are constantly looking at options, because we have access to everything, we've looked and we cannot find anything better than daily dosing of Test-CIP or an anthate alongside HCG as the starting point for your TRT journey. Propionate, the bros say, what about prop? Well, the Tmax is too high. And what you're going to do is you're going to metabolize the testosterone too quickly. Even though purported half-life is 2 to 3 days, in clinical practice, in reality, that's not true. So again, SHBG is the biggest factor when it comes to determining how long the testosterone is going to stay in your body outside of the ester attached to the testosterone. So, yeah, microdosing. Why do we get away with microdosing when the NHS says, the manufacturer says this, and all the evidence suggests that yes, this is the safest way of prescribing TRT? Because there is other evidence out there, lots of evidence, that confirms that shorter injection intervals will lead to more stable levels. Now again, this is basic pharmacokinetics. So the Society for Endocrinology have recently updated their guidelines to say shorter injection frequencies lead to more stable drug levels. And why did they do that? Yeah, you guessed it. They were looking at our practice because they have scrutinized our practice. We have faced the GMC before and won because we practice safe, evidence-based medicine. And we presented the evidence because it is out there. So the Society for Endocrinology have confirmed that shorter injection intervals lead to more stable drug levels. But they haven't gone on to say microdosing is more effective, even though logically twice a week to daily would obviously be more stable and potentially effective, because again, the premise is to mimic physiology. What else did they do? Yeah, they spoke about subcutaneous injections. And nobody was doing subcutaneous injections before we started doing subcutaneous injections. They've actually added cypionate, which is unlicensed in the UK. Don't worry about being unlicensed. Doesn't mean it's unsafe. It just means that it's licensed somewhere else and we utilize it properly here in the UK. So, wow, we have directly affected a change to clinical practice. So to say that doing anything else aside from prescribing Testosterone and libido is nonsense is nonsense. Oh my word. So what else? Yeah, it's a weird world out there. The TRT field is cutthroat. I have a doctor messaging my patients, trying to get them to be friends on Facebook. Oh my word, have you heard of probity? You should be reported to your responsible officer for trying to poach patients from another clinic to your private clinic. That is wholly unprofessional. Isn't it, Dex? We don't like that, do we? But we're not threatened, obviously. Because if there's one thing I expect, it's loyalty. And if you have no loyalty, it's no loss if you go somewhere else, is it? So, you will have loyalty from me, and I would like loyalty from you, because, again, we are essentially mirrors. What we project out into the universe is hopefully what we receive back. Now, it might seem sometimes that you're being tested, and perhaps you are. But what are you going to do? You're going to rise up and battle, and you're going to overcome the adversity that you are challenged by. You want to see opportunities, challenges as opportunities, not threats. And you've got to appreciate, out of darkness comes what? Yes, light. So it doesn't matter how bad things are, how down you are. Pick yourself up, because we're all walking wounded. All of us. I've just come from the gym. I'm currently nursing a torn meniscus in my right knee, and I'm just trying to recover from serratus anterior palsy. Do I care? No. I have to adapt and overcome. I'm in charge of me. You be in charge of you. Don't look to the path of least resistance. Look to something that makes sense. Microdosing TRT. It's not rocket science, guys. So, nothing else to say apart from, you know what? Go earn your reward. All right, Dex, let's go for our run.